So we're going to get started. A lot of people have messaged or emailed asking if this is going to be recorded. It is. It's being recorded. It will be up on our YouTube channel. I'll make sure Debbie has a copy as well. And I'll make sure to post a link in, if you're a member of the Dental Billing Coding and Insurance Academy Facebook group, there'll be a link posted in there as well. So with that, we'll get started. We are here tonight to talk about the 21st Century Cures Act, talk about ONC. I'm sure we'll mix in a little bit of Hipaa and absolutely network security. But, for those of you who don't know, Debbie is my co-host for tonight. And Debbie, if you would just take a few minutes and just tell everybody about yourself.
Well, I'm Debi Carr, and I am a cybersecurity consultant that works with doctors to implement security in their practices, as well as when there is an incident, to help them to navigate through all of the challenges and the events that have to take place in order to meet federal and state laws. We have to be ever mindful of those regs that are there for us. I live in outside of the Orlando area, but I do travel all over the United States, and I love what I do.
That is fantastic. How is it in Orlando right now?
Hot.
That's what
humid. It's welcome to summer.
Exactly. Well, the other thing I will say, the Cures Act has been a very hot topic.
Yes.
All across every board, every Facebook group, every message group, everything. And, I think there's a lot of inaccurate information. I had a post a couple weeks ago in my Facebook group where somebody actually called the ADA and was told it doesn't apply to dentists. You don't have to worry about it.
It absolutely does apply. I hear that about Hipaa as well, that I don't have to adhere to Hipaa because I'm a dentist. And I have to tell you that dentists, I came out of perio. So the healthcare, dentists are healthcare. We are actually often the first line of defense. I can't tell you how many times the doctor I worked for sent someone to a medical doctor because of something he saw in the mouth. And so we are part of healthcare. So this myth that dentists are excluded is going to be a very costly mistake, because the fines with the CARE Act, they outshine Hipaa.
Right. And that I think is something that's important for people to understand. There are a lot of rule changes, a lot of newness coming out. It's not just Hipaa, it's not just ONC, it's not just the Cures Act, it's OSHA is getting ready to release an emergency order specifically for healthcare. I was just texting with someone else just a few minutes ago about that, because that's getting ready to come out. We're going to see what the new requirements are going to be for that. They're going to be a more permanent order, still a temporary order, but a more long-term permanent. OSHA is going to say, yes, this is what those in healthcare have to do. And the important thing to remember is they do apply to dentists.
Absolutely.
So many dentists fought during the closures, during the mandatory shutdowns, we want to be considered healthcare professionals. We want to be able to open and treat our patients, and we're causing damage by not being able to treat their patients, all of which is true.
Absolutely.
And now they're saying, oh, well, I'm not healthcare. Those rules don't apply to me.
Yeah, no.
but they do. And that
absolutely.
I think that's the important thing for people to remember. So, let me ask you this, because, I'm sure everybody gets tired of hearing me say the same things over and over and over again. So, we talked and I mentioned, ONC and Hipaa. Would you kind of just, briefly in your experience, would you explain the difference between ONC, Hipaa, who's covering what, who's going to handle
Sure.
what?
Sure. Okay. So there's a lot of hands that are in the till here. So everyone knows HIPAA. It's been around since 1996. So that is the Office of Civil Rights. And because when your information is compromised, it is a violation of your civil rights. Now with ONC, the Office of National Coordinator, that is a whole different department. Now they both are under HHS, but they operate autonomous to each other. However, I see some things coming down the pike because you can't have conflicts in laws like they have. And we know that HIPAA right now is in what they call the public, where they're taking public input on the upcoming proposed changes to HIPAA, which will align with the 21st Century CARES Act. The 21st Century CARES Act it went into effect in I think it was proposed in 2014, and then actually went into effect with 2016 with the projected, because it always takes them a while to get their act together. And so we saw it go into, this part of it go into play April 5th of 21. Now, there's been some things that have been in play for quite some time, which is why I follow the 21st Century CARES Act, because my medical clients had to have what they call a certified EMR. And, having those certified EMRs in medical was something that I needed to be aware of. So far, we don't see that in dental, but we are seeing the information blocking rules in dental, and we are seeing the patient portal rules in dental. So it's coming, but right now we need to worry about what is in effect today. And as of April 5th of 2021, information blocking can be very costly. I believe that the first fine for information blocking is $1 million per record.
Yeah, that is the current fine.
And that's far more than HIPAA.
Right. And that, you brought up an interesting point. We were actually talking about this just the other day. You have two entities that have two different rules, because information blocking, the ONC is saying, those records should be released within 15 days.
15 minutes. The reality is they're saying that everybody should be electronic, that this should be a no-brainer, and that it should be available on a patient portal. And so the way that my understanding, and again, coming from the security standpoint of it, my understanding is you do not need to have a patient portal until a patient asks you for access to the patient portal. But once they ask you, then you have to have it, and you have to give them full access to their record through a patient portal. They can also come in and they can ask you to put it in an app, where there's so many health apps these days. Right. They can ask you that you put that information into a health app, and we have to accommodate. We are under the law to accommodate as of April 5th as quickly as possible. And yes, I know right now HIPAA is 30 days, but ONC is 15 days or less.
Right. And I think that's the important thing to remember, is it's or less. It technically is as quickly as possible, but no more than.
For free. This is also another thing that I read about on Facebook a lot of times. Oh, well, they've got an outstanding balance, and so we're going to charge them the outstanding balance. Well, first of all, we won't even go about the balances, but information blocking, if you're not releasing those records and you're charging them for their records, that is considered information blocking.
Right.
They are supposed to be free under ONC, under the CARES Act. Now, under HIPAA, you may charge $6.50 unless you can document, and it comes down to documentation, that you have to charge more. But you cannot charge them what they owe you. You have to charge them $6.50 is the max.
Right. And I am constantly amazed at how many dentists will say, I won't release them until the balance is paid. I didn't
Well,
charge them for that x-ray. So if they want me to send it to another doctor, they have to pay for the x-ray first.
yeah,
I
you
don't,
know,
I just saw a post yesterday in a group, not mine, because I would have shut it down in 14 seconds, but in another group where they were talking about that. And the majority of people said, I wouldn't do it. I wouldn't release the records. They can sue me. Well, no, they're not going to sue you. They're going to call
you.
They're going to call
let me,
OCR. They're going to call ONC.
yes, and let me give you a little clue as to what happens when OCR walks through the door. Now, 21st Century CARES Act just went into play April, 1 month.
Right.
So I've not, in all honesty, I've not dealt with the ONC auditors. I have dealt with the OCR auditors. So let me give you a little indication of what happens when an OCR auditor walks through the door, because they've got a patient complaint. They don't come in and say, hey, we've got a patient complaint. We just want to look at her record. We're only going to be here for 15 minutes. No. They take that opportunity to determine what is your security posture. They're going to ask you for your last risk analysis. You are looking at a minimum of 10 days down, no productivity, not to mention the fines that will be associated with it. So, and consistently in the top 10 list for OCR, Office of Civil Rights, which is HIPAA, they list lack of risk analysis as the number one reason that they're handing out fines. And so often I hear that it doesn't apply to me, or no one ever told me. This law has been around since 1996. It has not changed. Now, I'm the first to admit I don't know the privacy. I have to, kind of call my buddy Rick when I have a privacy issue. Because my wheelhouse is the security. I can cite you chapter and verse of the security rule. HIPAA, I mean the privacy rule, not so much. Breach rule, yes, because I've had to deal with it so many times with my clients.
Right.
So this is not, and then I can not see ONC being as nice as OCR, because the reality is the auditors at OCR, they genuinely just want to make sure that the practice is taking security seriously. And I want to circle back to that down the road a little bit here, but ONC is not going to be that gracious, because ONC oversees CMS, which is your Medicare, Medicaid departments. Right. And so we already know, based on history, how kind they can be. Not very.
In my experience, and like I said, this is all brand new. So I don't think any of us have dealt with an ONC auditor as of yet. And the only person I know who came close, because like you said, they also manage the CMS,
right,
is Roy.
Yes.
And we all know how his experience went. The last webinar we did with him, when he talked about the FBI at the back door of his office, walking in, calling him at the seminar, that's how it went. So,
and that's what happens a lot of times, because what happens is, in my world, what happens is that a doctor will have a breach. They don't want to deal with HIPAA. They think no one is going to know. No one will ever find out. My IT comes in and they start cleaning up and they get me back up and running, and no one's ever going to know. I have some news for you. The FBI, the CIA, and a few other departments monitor not only the dark web, because now we're not even seeing data on the dark web, we're seeing it on the web.
Right.
They're monitoring, and what happens is they walk through the door, and by the way, your data has been found on the internet and you knew about it and failed to report. So that is blatant negligence.
Right. And
So, and I think that knowing that this law went into effect April 5th, playing this, they owe me money, I'm not going to release the records, or that they didn't pay for their x-rays, I did it as a promotion. As soon as, and this is my understanding, please correct me if I am wrong, my understanding is as soon as you create the record, which you have to create the record in order to take the x-ray, you have now created a patient record, and anything and everything is considered the patient's record. And so if you don't want to charge for it, great, thank you for doing that gratis, but it is the patient's.
right, people don't understand that, that record is created because when we talk about the privacy rule, there's a couple different things. The privacy rule covers protected health information, but it also covers personally identifiable information.
Correct.
So for most of us, we're using EagleSoft, Dentrix, Open Dental, whatever it may be. The minute you create that record and you use the patient's first name and last name, a phone number, an email address, anything that identifies that person, you've created a record. I saw somebody who said in a different group that we had a patient, she called, she scheduled, we took her information, we verified her insurance, we went through the whole process.
Got a record.
She never showed up for her first appointment. You've never been in my office. You've never signed my notice of receipt of privacy practices. HIPAA doesn't apply to you. And she wrote a bad review and they blasted it and violated HIPAA 10 different ways because the record was created.
Right. So when I've had an incident and we're counting up the patient records, we don't look at who had an x-ray or who physically came in. I'm looking at what record was created. So as soon as you say a new patient and you put in a name, I have a record. And now if you have any associating identifiers, and the thing that we have to remember is it's not just where PII is concerned. It's not just HIPAA. It's not just ONC. We have 50 states plus Puerto Rico that all have some sort of protection in place for their residents to protect their residents, no matter where their residents are. So we have Florida. We have a lot of people that come from the Northeast, not this time of year, usually.
So they left already.
They leave in April. Usually they're not leaving this time, but usually they leave in April. But if their primary point of residence is New York, New Jersey, and the doctor here has an incident or has a breach, because we're only going to report breaches. But if he has a breach, then we have to report to those states. I have a doctor that is in a state in Massachusetts, and we wound up reporting to Massachusetts, New York, New Jersey, Delaware, and Virginia and Pennsylvania, because her patients had moved during COVID, and that's where they were at the time of the breach. And I want to say one thing about that. There is a difference between an incident and a breach, and this is why the steps that are taken when there is a cyber attack are critical. If you make the wrong move, it can be very, very costly, because what happens a lot of times is the IT goes in and their emphasis is getting you back up and running, but you have a crime scene, and it is imperative that you follow the HIPAA security rule and the HIPAA breach rule that says you will conduct a investigation to determine the extent of that incident. It becomes a breach when your information is misused. So if just now OCR says that the fact that it's locked and you've lost control is reportable, but if we can document certain things, and it takes a forensic investigation, and it means your IT cannot do a forensic investigation. It takes somebody who is experienced in forensic investigations. It takes very expensive software to review those lines of code, because you need to know exactly when the threat came in, when it launched, did anything go out? You've got to be able to say that beyond a shadow of a doubt. And most IT, in fact, I do not know of any IT companies that can do that. I know of some that can tell you, well, we think it came in through RDP, but when you ask for that document that you need to meet HIPAA to say you do not have to report, they're not going to sign it because it's liability for them. So it's really, really critical that offices know what is expected of them, and that they follow. The only thing IT should do is tell you to unplug the Cat 5 and don't power down your computers.
Right. That is it, really. I mean, everybody, not everybody, but there's been a lot of ransomware hits over the past 2 years, really.
We have seen an increase in healthcare ransomware, 334% from 19 to 21, which is what the year that we were all in hibernation. But guess who else was in hibernation? The hackers.
Yep.
So they were very, very busy, and we were all in chaos. We were all in hunger mode, and we weren't thinking. And so we're clicking on anything and everything that brings that we could to find out information, and we're posting like crazy, and so we're allowing phishing attacks, and there's just it's a never-ending cycle. It is estimated that an attack will happen every 11 seconds in the United States.
Wow, that's
Not only have we seen an increase in ransomware, we've also seen an increase in identity theft. And where are they getting this identity? They're getting it from the offices that they hack. And I often hear, I'm just a dentist, nobody wants my information. Okay, 21st Century CARES Act. We have their demographic information. We have their dental insurance or dental benefit. I don't like to call it insurance, but we have their dental benefit. And we have their oral health history. But wait, now certain procedures have to go to medical. So now we need their medical insurance. And now we want to know that they are on a blood thinner. So we take their health history. So the dental office is the crown jewel. Hackers love when they find out they're in a dental office, because they can recreate an entire person with the information from a dental office.
Right. And I've for the past few years, when I've been teaching a HIPAA class, I'll always say a hacker would rather get into a dental office than a bank.
Oh, absolutely.
Banks are super high security. Dentists are very lax.
Low-hanging fruit.
But I can go and, I had a professional white hat hacker at one point walk me through, what we'll call the dark web, and name, date of birth, social security number, 50, 60 cents per. You can buy 10,000 of them on a spreadsheet.
Medical records, $5, $10, $25. I've seen them go for from a dental office. There was a dental office up in New York that was hacked. I saw those records going for $53 a record.
Right. And that is, that's a huge thing. And people don't realize, those medical records are for sale. And what people fail to remember is there are some countries throughout the world where it's not illegal to buy stolen health records.
Right.
And if you think the pharmaceutical companies don't have offices in those
there's a lot of reasons why health records are stolen. Obviously there's for the care they need, they need a transplant, they need the insurance, they need to be able to recreate that information. And we live in a very sick world these days. And so there's some very, I could tell you some horror stories, but identity theft is at an all-time high. And I'm going to leave it at that, because when your identity is stolen, it's very, very hard to prove who you are. When you get a letter that says your house has been taken because of information that has been found, I know. I mean, I can tell you all kinds of stories, but actual things that I've worked on.
Right. I actually just was reading about someone who just a few months ago literally got a notice in the mail that their house no longer belonged to them.
Right.
And he was $400,000 or $500,000 in legal fees and this in so far, and
right.
still didn't have his house back, and
nope.
said, I probably won't get it back.
Right. They're probably going to lose their house.
Recorder of deeds. I mean, there was a whole process to
yep.
it.
So I always recommend that everybody call their local comptroller's office of their county and sign up. Most comptrollers, at least I know here in Florida and several other states, all have where you can call the comptroller's office and put your name on a list, that if there's any transactions that have your name or your address on it, that you will be notified. Now, granted, you're not notified right away, but you are notified within, I think it's like 10 or 15 days of the recording. So you can at least jump on it. But when, months, years have gone by and you're not aware that your house has been a quick claim deed, they've taken out a mortgage, you don't own your house anymore.
Yeah. And that's the other thing, taking out a mortgage, taking out a home equity line. Mm-hmm. On right. your house, because they are you.
Right. Right. I have a hygienist right now that's fighting a $50,000 medical bill with a hospital that her husband supposedly had back surgery. He's deployed. He couldn't have had back surgery. So they love when they get into it. I do see a question about what you need to do is you need to unplug the blue or gray cord from the back of your computer and just leave your computer alone, and then start taking the right actions.
Right. Don't turn your computer off. Don't shut it down.
Right.
Disconnect it from the internet.
Right. Exactly. Exactly.
That's
because
what you want to do.
Right. Because that hacker has probably been in your system for a while. What I'm seeing now is what I've seen since October is the average time that they're sitting in a system is about 48 days. And they are exfiltrating data. They are taking it. And like I said, they're not even posting it. They don't even care to post it to the dark web anymore. It's blatant. They want money. And they know that if they post it, you've got a report and that you're going to pay them to keep it quiet. And so they're posting it onto a regular page. They'll send you a note and say, here, go check out this page so you can see that your data is there. Because again, they want to create that scare. And it's just about doing the right things beforehand to protect yourself against that. Because paying them does not guarantee you that you're going to get your data back. It doesn't guarantee you that you are going to get a clean data back. And it doesn't guarantee that you're not going to be a target, because you already are. So we don't know if they're in, when they send you that key, are they embedding code into, we call it a backdoor logic bomb. What is in there? So,
and I tell people all the time, if you get audited by an insurance company and they find you're a mess, and mm-hmm. you pay the reimbursements and the penalties and everything they do during an actual hardcore audit, they do what they call a referral. So if mm-hmm. Aetna came in and audited you, you better believe they're going to let MetLife know, hey, we were just in there. This place is a mess. You better get in there. And then right. Life is going to call Delta, and so on and so forth. And the problem is the hackers are the same way. So
I've had offices where there was three different hackers in one office. They were each doing different things. And
Right.
nobody knew they were there because they weren't doing what the office wasn't doing what they were supposed to be doing, which is another change to HIPAA that I literally was jumping up and down for joy on January 5th, because the change to HIPAA creates a safe harbor. If you can demonstrate that you have implemented a security program that aligns with a recognized security protocol from the National Institute of Standards and Technology, it creates a safe harbor. It reduces or removes any penalties. It removes audits. And that's something I think that people miss. You get this, we'll see where OCR levied a $10,000 fine against this dentist. What they're not seeing is, and 2 years of oversight. That means OCR is in your office for the next 2 to 5 years. And so, but this reduces the audit time. And so I use with my client a framework that is called the cybersecurity framework. I've used it with my clients since 2015 when it was first really introduced. And it is NIST approved. It is scalable at any office. My family uses it in our home because my family are all in the security world. And so we use it in our home. So that's how scalable it is. So there's no excuses. I literally was jumping up and down because this is something I've done with my clients, again, all along. And now it creates a safe harbor for them. And so I was so excited.
Yeah, I think people missed out on that because, I know you said this before, but OCR doesn't want to come in and give you $20 million worth of fines and put you out of business and close you down forever.
They won't do that.
Right. However, they will issue fines and penalties.
And they want it to hurt.
Right. But they want to see that you're trying. And that was the safe harbor, the new safe harbor law that started at the beginning of this year. We were talking about it a lot at the end of last year, is just that. Show us you tried.
Right. I mean, how can they go in and find a dentist when NSA is hacked? But so it's not a matter of if, it's a matter of when. They want to know, what was your security protocols? What was your security plan prior to the incident? If you've done everything that you're supposed to do and this still happened, it still happens. I am very, very protective of my credit card. I am very, very protective of my credit cards. But invariably, thank you, Equifax, my credit card every once in a while will get compromised.
Right.
And I have the inconvenience. I have to deal with it. But when your patient records are compromised, and the other thing is that so often the practices put all of their emphasis into their practice management. I actually am dealing with an IT company right now because I want unique user on the for each employee, which is according to the law 164314A1, you will have unique user to the information system. See, I told you I can quote security rule. I can't do privacy. But the unique user, and his comment to me was, isn't that overkill? No, it's not overkill. It sets up for protection against embezzlement, because you can tell exactly who is doing what, and it sets up protections for you to be able to know who's doing what. Also, there are other applications that have patient information in them that are critical to the operation of the business. We look at, the sensor, the whatever X-ray you're using. Yes, you see it bridged through EagleSoft or Dentrix or Open Dental, but if you were to go out and click on the actual icon for that Sirona or for your CBT or whatever you're using for a sensor, you will see a full database of patient information there. That is not encrypted. That is open. The other issue that I had during COVID was I had doctors that their QuickBooks were locked, and they had their patient data. That was not the problem. The problem was they're trying to apply for PPP loans and their QuickBooks is compromised and locked up, and they can't get to it. And so, and all of their employee information is on there. Right. And so it's knowing what applications, what is critical to the operation of your business, which is part of the cybersecurity framework. You, under HIPAA, you have to have an inventory. And so often people think, oh, I've got the inventory of, I know we got Dells on every desktop. Great. What applications do you have? Because when you pay for those applications, it becomes an asset. Your employees become an asset.
Right. And that so many people miss out on that. This is something that I talk about a couple hundred times a year. Is it's not just a unique log on to Eaglesoft.
Right.
If you type a letter to a patient in Microsoft Word and you save it to your My Documents, now that is electronic protected health information. It's personally identifiable information. It has to be controlled. You need access logs. You need to know who looked at it and when. Right. And if I'm just logging into front desk 3 with the password smile exclamation point 123,
or doc knows that. Doc.
Right. I had a client actually probably about 4 or 5 years ago in Washington State. I won't say the city because there's only 2 of them and you would know who it was.
Okay.
In Washington State, who actually got hit with a wrongful termination lawsuit because he fired a male hygienist because that male hygienist, in between patients over lunch breaks, was visiting adult-oriented websites on the computer in his operatory. They were set up on a work group. Everybody logged in as Hygiene 1, Hygiene 2, Hygiene 3, Op 1, 2, Op 3. He got fired for doing that, went in front of the judge, and the judge said, prove to me that it was him. Well,
you can't.
I can. Right. And the minute the hygienist said, everybody knows the password to that computer, all 7 computers in the office have the same password.
There's so many issues with that.
Salary.
Right. There's so many.
And the insurance company, the doctor's insurance company, would not pay it. Right. Because the doctor violated the requirement.
Right. I had a client that had an incident. She had cyber insurance. So we thought we were good. The first question they asked her was, when was her last risk analysis? She had never done one because she didn't know that she had to have one. She had done HIPAA training, but she had never done a risk analysis. They denied her claim.
Right. Right.
Because she had not done, because she had said that she was HIPAA compliant when she was not HIPAA compliant because she had not followed the security rule. So, and that's what the safe harbor does, is it incentivizes doctors to implement security protocols, not just following HIPAA, because those are, believe it or not, those are the bare minimum. And just one more little throw in, just while we're on regulation now, HIPAA, CARES Act, the safe harbor, those are all federal laws, and they are all laws. And we talked about state laws, but there's one other little tidbit in there that is called contractual law. And it's that these doctors have signed to accept credit cards.
Right.
And they have to follow PCI in their offices. And when they're not following HIPAA, because they don't have a IT company that is monitoring their activity, they're not following PCI as well.
Right. Exactly. And that I actually just did a drive live on
I saw that. That was the first one I got to see.
and because so many people forget about that, well, I own the business, I can make the decision. There are
Don't sign
so
the
many
paper.
different rules out there that apply to all of us.
Yeah.
I fortunately in my office, we don't have a credit card terminal because everything's done through Intuit and QuickBooks, and they deal with it and they deal with the ACHs and all. They have to worry about that.
Right.
I don't store credit card information. Let Intuit deal with that. They have way more money than I do.
Right.
That's the way it should be. But real quick, Chelsea asked, so every computer needs a different login per employee.
No, every employee needs a different login.
Right. That's the
Every
way
employee, right, that's the way it should be. Every employee should have a unique user that no matter what computer they go to, they can log in. Think of a hospital setting. When a nurse goes in or to a hospital, the front desk person can take your information and they create your record, and then they close it off and they go to the next person, and then you go back to triage and that nurse is able to access your record. They're always building on it. There's no reason. And it comes down to workflows, because my clients all over the country have no problem doing this. I just have to get their IT to put them on roaming so that they can do it. But every employee should have their own unique user and their what we call credentials, their own credentials, so that they are able to log in and they are able to in whatever computer they are on. And it just comes down to the workflow. And so often I get pushback from the assistants. The front desk are usually very amicable. It's the assistants. But when we work with them and we show them how to handle it, the workflow, they're fun.
Right. What it is, I mean, just so everybody kind of understands, in my office, if I'm sitting at my desk and I log in as Rick with my password, and my computer has facial recognition and all that fun stuff. I log in as me. My desktop is my desktop. The documents that are there are there. It's set up the way I want it. My background picture is the one that I want. Everything is mine. Now, if I get up and I walk across the office and I go to one of the cubicles in the cube room and I log in as Rick, all my things are going to be on that computer.
Correct.
It's
Correct.
a roaming profile. So no matter what computer in the office I log into, I log in as Rick. If you're Chelsea, whether you're logged in on the front desk one computer or the dentist's computer back in their office or the Pano computer, you're going to log in as Chelsea. And everything is going to be there no matter what computer. So
and Chelsea, in answer to your question, yes. But this comes down to workflows, and it comes down to knowing how to create those workflows that will allow you to be able to change. The question is, if we have an open chart and are changing providers within the same room, do we need to log in each time we change providers during that hour? Yes, because whoever is working on the chart, whoever is going to be entering the chart is the only one that should have the chart open. Now, again, it comes down to workflows, and if you want, Chelsea, I'll be happy to talk to you offline on getting some workflows that can help your specific office, because each office does operate uniquely, and that's fine. We definitely want that. I call it the principle of individuality, and we want to maintain that principle of individuality because that's what your patients love. They love what's happening in your practice, and this is not meant to impede patient care. It's meant to protect the employees, because that way nobody can point at you and say, you did something that you did not do. So there are ways to manage the workflow so that you can still give patient care and still accommodate everybody.
Right. And everybody knows we do remote billing for
right.
medical offices. So we're logged into their networks. We're logged into their computers. We're logged into their systems every day.
And we've already talked about it to make sure it's secure.
I've had offices who have said, just log into this workstation. You know, it's admin and the password is capital P at SSWORD1. And I said,
Yep.
we won't do that. Set us up our own login. Well, why? Why won't you do that? Yeah, I have to call my IT company. They're going to charge me $50 to do that. Here's why. Because if I log in as admin and I navigate myself to your server and I delete your EagleSoft database, who did it? Well, you did.
The
Prove it.
assistant. The assistant did it.
Done it because she knows the password. You know, I could have done it because you didn't pay me last month. Anybody could do it. And the only person who gets hurt is the dentist because they can't prove anything and they eat it. And
ultimately, they're the ones that write the check. No matter what, they are the ones that write the check.
Right.
So it protects the employees, it protects the employees' jobs, and it protects their boss.
Right. I just did an installation with a brand new client. I think it was Monday or Tuesday. I can't even remember what day it is today. But Monday or Tuesday.
Thursday.
There you go. See, ever since Seinfeld went off the air, Thursday doesn't mean anything to me anymore.
Sorry.
But I did an install and I created our login for the domain. I created our login for her EagleSoft. And she said, okay, well, the dentist wants to keep a list of all the passwords. So what is the password that you just made for your login to EagleSoft? And I laughed and she said, what? And I said, I'm not giving that to you. She's an administrator. If she needs to remove my access to delete me out of the system, to whatever it is, she can do that as an admin. She doesn't need to log in as me.
Right.
I don't care if you're the owner, like my office. I don't know a single one of my employees' passwords. I don't want to. They'll say, oh, IT needs to log in and they need to install this, but it's user specific. Can I just leave you my username and password because I'm off tomorrow? When IT needs to get in, you can log in for me. No, I don't want to know.
First of all,
for next week.
First of all, yeah. And one of the things that I recommend for the doctors, because I know that they are the owners and I know that they want that admin privilege, but when a hacker has been in your system for 48 days, watching all of your keystrokes, and that's what they're doing. They're watching your keystrokes. They're giving themselves the privilege. So what I always recommend is that doctors have two accounts. They have the admin account that is never used, that is tucked away somewhere, and they don't need it. They don't use it.
Yep.
And then they have a user account with limited. I had a practice here in Florida that the hacker had been in the system for about 4 months and decided that he wanted to pay himself $50,000. So he, by this time, because he had watched the keystrokes so often and nobody was monitoring the network and not monitoring users. So what the hacker did was he sent himself an iPad and a very nice Alienware laptop.
Ooh.
And then he transferred $50,000 to himself. Using what he did was he went into their ADP account and changed the doctor and the associate's payroll information to his, and then did an unscheduled payroll for $50,000. Once that money goes out, there's no pulling it back.
Right.
They transfer it. They know it's going to hit this account, and they transfer it to another account literally within seconds. And so it's they are very sophisticated. We are in a cyber war. That's just the reality of it. And we can't continue to put our heads in the sand. The only way we can protect ourselves, and what we have to remember is we're all patients in a doctor's office somewhere. And our patients are trusting that we're going to protect their information. That's why when we say you need to have again, I came out of perio. You need to have surgery on your lower right to get that inflammation down. They trust the doctor to follow through with that treatment because they trust the doctor, because they've given you their information. And so it's important that we uphold that trust by securing our information and protecting our businesses.
Right. And that's really what it comes down to, is protection.
Mm-hmm.
And again, you have to remember, part of the whole safe harbor and the whole reasoning for all this is security is all about layers. And the
Yes.
more layers you have, the better.
Yes.
If an onion had one layer, it'd be real easy to get to the middle of
And it's funny you say that, but that's how you get to the dark web. You have to peel back those onions. In fact, they call it the onion router.
it. Exactly. But I also know that OCR, everybody understands that if somebody really, well, you could have 37 layers. If somebody wants to get to you, they're going to. I
Yes.
saw a number of years ago, I was watching a special about the Secret Service. And this is something that has always stuck with me. The former director of the Secret Service Presidential Protection Team said on national TV, I mean, he was retired, so I think he could, you could have 200 agents surrounding the president. If somebody is willing to trade their life for his, there is
nothing you can do
to stop
them. How many agents do you think were around Reagan when he got shot?
a lot.
Kennedy when he got shot.
Right. They were wearing bad suits in the 80s when Reagan got shot. But still.
But the point is, and these threat actors are very, very, very sophisticated.
Right.
What we're seeing now, the thing that I preach on the most is your safest thing is to have a full system backup away from your network. And because I know that IT, and I am a firm believer, let me just say this. I am a firm believer that every single practice needs to have an IT partner. It needs to be somebody that you don't put technology in your practice until you have a conversation with them, that they are your IT department. I am a firm believer because it takes somebody monitoring your system 24/7, and doctors cannot do it. So you do need to have an IT partner. But that said, I know that the IT companies, the products that they're using now are very sophisticated as well. But these threat actors are always one step ahead. The safest backup is the one that is not attached to your system. I've had backup accounts completely taken out and corrupted. I've had them completely deleted. I've had BDRs and datas where you're supposed to be able to roll back. That's been blocked. You can't roll back. The safest backup is the one that is not connected to your network.
Right. Right. And that's true. And that's something that's important for everybody to remember as we're talking about network security is, for anybody who ever watched Criminal Minds, people will always say, my IT guy is like, well, I forget what her name was, Penelope, whatever, the behind the scenes computer girl on Criminal Minds.
Right.
Okay, well, compared to the hackers out there, she's 9 years old.
Right.
They are way better than the FBI. Listen, all of these antivirus companies are every day playing catch up because people who want your data are 10 steps ahead of them.
Yes.
And it's what they do. You fix
and there's a lot of people that want your data because they want to be able to analyze what your data has.
Right.
And we have a lot of things coming at us. Again, we are in a cyber war, and our best defense is to know that and have those layers of security. Have, everyone have a unique user, have backups that are not, have policies and procedures. use HIPAA the way it was meant to be, use the security rule, implement it correctly, have a risk analysis done of your administrative, physical, and technical controls, and implement the CSF, the cybersecurity framework. It is it's going to be the safe harbor, because the choices are in healthcare is either the cybersecurity framework or high trust, and high trust is very, very difficult. And so like I said, we use the cybersecurity framework in our home. You identify what information, you identify what controls you need, you identify what risks there are, and then you mitigate by putting the right controls in place. You protect that information with policies and with antivirus, and then you detect, you respond, and you recover, and you repeat.
Right. So,
but there's a lot of subs that go in there.
And this is going to become even more important as we move towards the patient portals.
Yes.
Now there's another connection, there's another API, there's another open door to your data that you're required to have the open door, but it's one more place for people to get in. It's one more thing that your IT company, that whoever's monitoring your network should be watching.
Yes.
Because it's just an open door.
Well, and right now I'm dealing with this with a client right now. I'm actually not dealing with it. Somebody else is dealing with it, but I was giving her advice on it. HIPAA says you have to protect patient information past, present, and future.
Right.
So when you take a contact information on your website, you contact us, and you have a little jab there where the patient can put their name, and they can put their phone number, and they can put their email address. Now we have 3 identifiers.
Right.
The fact that patient is filling out that paper or that form on your website indicates the intent to become a patient. They are the potential future patient that you are required to protect.
Right.
So that's an area also that I have a lot of issues with doctors, because they don't realize that information has to be protected as well. It needs to be encrypted. You need to have BAAs with your web designers that are collecting that information and emailing it to you. And the email to your office should be encrypted. You can't just throw this information out especially when you're using G Suites, the unpaid version of Gmail, because when you sign that EULA, you gave permission for them to scan how do you think they know what to market to you? Because you gave them permission when you just went to the bottom and said accept to scan your emails.
Right.
So that's why you can't send it through regular email, because you cannot say who in what country is reading your emails.
Exactly. And that, the past, present, and future actually brings me to one of the questions I got emailed in today by a couple people who weren't able to attend live because of another commitment, but they want to watch the replay and they still wanted their questions answered.
Okay.
But your past, present, and future kind of ties into this one, which is the information that was in a patient's chart, document center, clinical notes, ledger, x-rays, prior to the effective date of the Cures Act, so before 4/5/21, going into effect, need to be made available to that patient's portal for them to view. And I mean, I can answer that one and tell you it absolutely will. Once the patient's record is part of their record set, and remember, a record set is very loosely defined as anything you use to make a decision about the patient. Right. Their ledger, their clinical notes, their perio charting, their x-rays, letters that you get from the oral surgeon, letters that you get from the orthodontist, all of that is part of the patient's record. EOBs, this has been an ongoing debate. EOBs are part of the patient's record. because, well, they're still accessible.
See, I'm learning something here.
The patient gets a copy of it. Did you use the EOB to determine if the patient owed their $50 deductible or not? Yes.
Yes.
You used the EOB to make a decision about the patient's care or billing. It's part of their record. Yes, they're available online. Yes, but here's the issue. A lot of insurance companies will limit web portal access for out-of-network providers. So if you were in network with Delta Dental 4 years ago, but you decided to go out today because, screw them, and you're out of network now you don't have access to those EOBs online because you're out of network. They're limiting your access. Then they're sending a letter to the patient saying, hey, don't go to him, he's out of network. So you have to maintain that information. You have to maintain that data. So
I can see that.
And the rules are, they vary state to state, but generally it's 7 years after the patient's last contact with the office. That's how long you keep a record.
I'm glad I'm in Florida.
So, but Florida, every malpractice insurance company in Florida requires 10 years.
Yes, I know, but our state law says 4.
But your malpractice carrier will say
it says 10.
So even though the state, again, conflicting information, the state says 4, your malpractice, call them.
But that's another reason why you go electronic, because you can archive or inactivate and you still have that patient record. And so you're not, and that's a whole nother thing, because I'm always big on retention, making sure that you only keep records for the amount of time that you need to keep records and no more. Somebody was asking about email. There's a lot of great email companies out there. I personally suggest that you get with your IT company. A lot of times they have a product that they use and that they can monitor, they can set up and configure. It comes down to the configuration and making sure that all employees are trained. So again, that goes back to your administrative. You have to have a written policy. And if you, every single, without exception, every single dental practice, healthcare entity must have a written security manual. So your email policy should be part of your security manual that says it will go encrypted, and everybody is trained that they have to go see Joe up front to send an email through her thing to, so it is encrypted, and she goes through training every quarter so that we know that she knows exactly what to hit. I can't tell you how many times I've gone into an office and I'll say, okay, so how do you send an encrypted email? And they'll go, oh, we just do this, this, and this. And I go, oh, really? Okay. And then I ask the IT, did you do something that I don't know about? And they're going, no, they're supposed to do that. And I'm like, okay, well, we need to retrain because they're not doing that.
And
so,
this is why I say for both OSHA and HIPAA, a lot of people think, well, I went to the State Dental Association annual convention, took their HIPAA class for 2 hours in the morning on Friday. We're now HIPAA compliant. That's the HIPAA required training.
Yep. And that is what got my client in trouble, because she had done just that and she had nothing else. And when she had a cyber attack, because she had marked off that she was HIPAA compliant, but had not followed the security rule at all, there was no benefit.
No, the training has to be, and this is for OSHA and HIPAA, on your office's specific plans, programs, and procedures.
There's 2 trainings in HIPAA. There's the one you're talking about, and there's the security awareness training. So what you're getting at the state meeting is the security awareness training. What you need to be doing in your office every morning is reviewing one of your policies. And this is what I have my clients do, is in your morning huddle, pick a policy of the week And every day this week, we are going to talk about passwords. Do not share your passwords. Do not post your password. If your password is compromised, come tell the security officer. I have posters that I give my clients for them to put. I've got one client that actually he puts the posters in the employee's bathroom. But they see it. It's right on the door. They have to see it. They're little security reminders, because it's about constant security, and we have to protect ourselves. And so I just did a class, a 2-day workshop on implementing a security program in your practice. I'm actually hoping to do another one in the Norfolk, Virginia Beach area. We're looking at August for that one. And then I'm hoping to maybe do another one in the Carolinas, or even back here in Orlando, maybe September, October-ish.
Perfect. So, I just want to clear something up with the records, because Chelsea asked,
Yeah.
you must keep them 7 years. They become part of the record. Your record must be maintained for 4 to 7 to 10 years, depending on your state malpractice requirements, from the patient's last date of contact. So if you have a patient who has been coming to you consistently every 6 months for 20 years, you don't just, okay, well, it's 2020, we can get rid of all of Dorothy's records from 2012 and before. You can't. Her complete record must be maintained from the day it's created until 7 years after her last visit. Just because you have a chart that's from 2012 doesn't mean you can rip that page out of the paper chart from 2012 and throw it away. You have to maintain the records for 7 years, or 4 or 10, depending on where you are and what the requirements are, from the patient's last date of contact. So the last time you saw the patient, the last time they were in, the last time they called in and made a payment, that is when the clock starts. Or their 18th birthday if they're a minor.
And from a security standpoint, you have to protect their record, protect their identity for 50 years past their date of death.
Right. Exactly. And that I when I say that all the time, because the new big thing now among some consultants is, so we don't have to bill the insurance company, we're going to use a disclosure restriction saying the patient's not giving us permission to disclose that patient's information for that day, which means now we can't send that.
No, it doesn't work that way.
However, if you have a patient who does restrict disclosure, that disclosure restriction is 50 years after they die.
Right.
Not 50
right.
years from the day they sign it. 50 years from the day they die.
Right.
People forget the Kennedy autopsy records and all. People forget it was 50 years from the day he died.
Right.
All of that got released in big news, and now we can read the autopsy report. It was 50 years after he died.
Right.
And you have to do that. So that's as far as protecting the information. EOBs must keep for 7 years. Yes, they're part of the record. You keep them for longer than 7 years. You keep them for as long as that patient is a patient of record.
Right.
Plus 4, 7, 10 years, depending on your
on the last day of treatment
environment, whatever it may be. They have to be kept. And if you're going to comply with the patient portal, they're going to need access to that.
There's only we're gonna see a lot of changes in technology in the next year. I know I've been contacted by a couple of companies that are doing patient portal. I know of one EMR, actually up to 2 EMRs that are certified by ONC. They meet the criteria. They have a patient portal, so it's very easy there, and they're cloud-based. But I know that there's a couple of the patient contact companies that have already been experimenting with this, because this is not something that just came down the pike. This has been in the works since 2014. So they've known about it. So they've been experimenting with it. So I do know that there are some of the patient contact companies that do have that feature. You do not have to have it on until a patient asks you for it. Once a patient asks you for it, you have to give full access to their record. So look at it this way, your medical doctors, they are already able to do this. And so if you've got a medical doctor, you can go in and see your full record now. It's not just, and there's a reason behind this. We look at it from a dental standpoint, but I actually served on a interoperability board with HIMSS, which is one of my certification. When you have a situation, so several years ago here in Florida, we had a hurricane. This is just one example. We had a hurricane. In the middle of the hurricane, a very good friend of mine, her father-in-law was staying with them because we had a hurricane, and he started having health issues, enough to warrant that they had to go to a hospital during a hurricane. His records were not available. He was not able to convey, because he was not able to speak. He was not able to convey his health history. The idea here is to be able to give the continuance of care. That's why it's so important that when a doctor calls you and says, I need the x-rays, I need their full chart, it's the continuity of care. And that's what the whole premise of this is. Now, I get that the chances of someone having a fatality as a result of a cavity not being filled is probably somewhat minute.
Right.
You never know. What if that becomes infected? It goes through the bloodstream. I mean, we've seen cases like that.
It has happened.
And it has happened. So, do you really want to be on that end? That is the premise behind this. The 21st Century Cares Act is to give patient control. The records do not belong to the doctor. The doctor is the custodian of the records. The records belong to the patient.
Right. And that is what people, I think, tend to forget is you are the custodian. The records belong to them. They are entitled to a copy. You must take care of the records. You must maintain them. Right. However, they are entitled to a copy anytime they want.
In any format that they want it.
Right. And a complete copy. And what I think we're going to see, because 2 years ago, a year ago, 5 years ago, offices weren't planning for this. So I've seen chart notes from 2018 that say patient tolerated procedure well, daughter sat in the room and was a whiny little blah, 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 in a clinical chart note. Your patients are going to have access to that note. Now,
they already have. They've had the ability to view.
But again, I've seen dentists who say the chart notes belong to me. They're not part of it.
I know. Yeah.
Wrong. They are.
Wrong. Exactly.
Now, here's what we're going to see. If your chart notes are electronic and you go in and say, okay, patients are going to edit this, we have to take out where it says PITA patient, where it says this way. You can't edit a chart note.
You can't edit. Right.
You cannot edit them.
Right.
If you do, it's going to maintain a record, and the patient's copy
it's an audit log.
Yep. Show the strike through of what you tried to delete. So
and they can ask for an audit of their record, which is why all of the practice managements have the ability to do an audit. Right. So all that's doing is opening a can of worms. I've done expert witnessing. You can use your notes for reminders, but you cannot adjust your notes. And that's another thing that now I haven't been physically in an office since 2014. But one of the things that was happening then, because this act was in play then, we saw ICD-10 come out with every code that dental does.
Yep.
And we see that, and Rick, you'll have to correct me if I'm wrong, but I believe that now what we're seeing is where instead of sending narratives, you actually have to cut and paste the actual note.
Start note.
To send, and they're looking for SOAP. They're not looking for, they're wanting the SOAP format. Because I had a doctor, a practice asked me the other day that I was in up north if I knew how to do a SOAP note. And I mean, yeah, I mean, it's subjective, objective, access and plan, but I had to think what that was. But you know, that's what they're looking for,
Right.
is that format. And so, you know, we're going to see more of our procedures fall into the medical realm. If we're going to claim that we're in healthcare, and dentist is part of healthcare, eye doctors are part of healthcare, chiropractors are part of healthcare. Yes, I know they're the redheaded stepchildren, but they're being brought in to the main house.
Right. And that is what it is. And we're seeing a lot of that. You know, those chart notes have to be on point. Patients are going to have access to those. Insurance companies are already requesting them. You know, Delta changed their provider manual to specifically say the only acceptable narrative is a copy of the clinical chart note. That is it. That's what they want.
Right.
Nothing else is acceptable. If the claim requires a narrative, it has to be that. Now, are they enforcing it every time? No.
Right.
Are they documenting who's doing it and who's not, because they have 18 months in the case of non-compliance to go back and request money back? Absolutely. You know, things are going to get missed. Claims are auto adjudicated. Computers are doing the thinking, but eventually there's going to be a person auditing what the computer did who's going to catch them and say, okay, you know, we know that this dentist did this 10 times out of 100 claims. He sent 1,000 claims, 100 of those were lacking. Bam, we're going to ask for our money back. They extrapolate data all the time. So we have to make sure we have that. Now, we have another question here. I don't know if you can
How can I be sure that I'm 100%? How can I be sure that I'm 100% HIPAA compliant? I have had a risk analysis completed and all employees trained as well. But if the state HIPAA meeting is still not able to help the client you mentioned, how can anyone be sure? We trust the state board and try to abide by their rules. But how can we prevent violation? Okay, first of all, HIPAA is national, it's federal, it's not state. And that a lot of times that comes into play where people say, well, call your state board, and your state will give you what happens in your state, and you have to answer to that state. But the federal is what is oversees HIPAA, the Office of Civil Rights. So how you can determine if do you have a written security manual? You need to have a written security manual in your practice that has a policy for that you have an ongoing security management program, which means that you're training regularly, you're enforcing. I have actually, I have these little things that I give to my clients. They're HIPAA tickets, so that they can write their clients, their employees off for not failing to log off computers, password exposed, patient information accessed without a reason. So I mean, you know, you want to be able to document these things, that you have a written sanction policy. Go ahead.
I was going to say, I give one chance in my office. We're remoting into dental offices all over the country.
Yes.
I log into a client through our remote access software and EagleSoft is still open, they get a written warning. If it happens again, they're gone.
Wow.
On the spot, terminated. And I can see through my access logs who the last person that logged into that computer was.
Right.
So
but that comes down to training. Right. But it comes down to training. Because you certainly are not going to terminate somebody without telling them. And so often we just throw, I've had been in offices where they've looked at me and said, oh, any high schooler can answer the phone. That is a whole different conversation, because that is not true. That front desk is your first impression, but that's a whole different conversation. Security is an ongoing process, and security is, like Rick was saying, it's layers. You can't just say one and done and I'll see you next year. It's an ongoing, ever changing, ever evolving. You have a policy in place for hiring. You have a policy in place for terminating. Everyone has unique user. You're auditing. You're working with your IT to audit what's happening. They have firewalls in place, which, HIPAA says you'll have a mechanism. PCI says you will have a firewall. So that's what I'm saying. When you look at the best practices, which is why I love the cybersecurity framework, because everything just falls right in. My husband will tell you, I was jumping up and down. I was so excited. It's an ongoing process, and you've got to show constant documentation. Every morning huddle or every staff meeting, pick a policy of the day or policy of the week, and you review that policy and you review that policy. You put a sign up, and then you have everybody sign that they saw it, that they heard it, that they know the policy. Because when OCR comes in, they go to your employees and they say, hey, did you know? Were you ever told? They interview your employees. So you want them to shine light and say, yes, they drill into us. Don't post your passwords. So it's having that ongoing basis that that's how you're going to know that you are doing something in security every single day, not even whether you're open or closed, every single day in your house. When you leave your house in the morning, you lock your door. Why? Because you want to protect your house from potential people coming in that should not be there. You take that security seriously and you lock your door. You need to be doing the same thing in your practice.
Right, absolutely. And you can be creative with it. I had a client, a very large hospital, that I was doing, some HIPAA training and privacy consulting with their privacy officer and their privacy team, because big huge hospitals have a security team and a privacy team.
Oh yes.
So but in dental offices, it's your office manager or the dentist who is everything all in one. But we did every Thursday, I think Wednesday or Thursday, in the employee cafeteria. It was like Chinese food day. We had custom fortune cookies made with little privacy rule reminders as the fortune.
Oh, I like that.
Every Wednesday, they got a fortune cookie and they opened it up, and they, that was their daily reminder of don't share your password. Don't
right.
This. At that point, they were doing a lot of biometric stuff. So it was, so just different things, just little things. It doesn't have to be, every day doesn't have to be a risk analysis.
No.
Little reminders, little things. And like she said, I think like Debbie said, oh, we trust our state dental association. They're making the rules for the state. The Fed is making the rules for the country. You have to follow, and we talked about this a little bit before. Anytime there are conflicting rules, follow the stricter of the two rules. So if the Fed says release the record in 30 days, but your state says 10, it's 10. You follow the stricter of the rule. And when it comes to HIPAA and record access and security, the stricter rule always is what's better for the patient. Not what's better for the dentist. It's what's better for the patient. Is it better for the patient to get their record in 10 days or 30? And the other thing you have to remember is, and I know you talked about this, but I just want to clarify, the rule applies to where the patient is. I'm in Pennsylvania. Pennsylvania says 30 days, just like the Fed. California says 10. If I have a patient who came to my office in Pennsylvania, had 10 years worth of dental work done, moves to Los Angeles to become an actor, and calls me and says, I want my record, I have 10 days.
10 days.
Because I have to follow the state law.
Where they live.
The patient is in.
Yep.
Not where the office is, where the patient is.
Right.
So this is why I've been saying for years and years, when a patient calls, send them their record. Not next week, not next month, not in 30 days because they owe me $140 and I'm going to make them wait the 30 days and hope they pay. Send it now. It takes
Collect up front.
2 minutes. Click, 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 save as PDF.
Yeah.
Encrypted email, off it goes, and you're done.
Exactly.
Just
exactly.
send it over.
And I think that we're going to see with the fact that they're taking the public forum. I mean, we already know because you can see the public comments,
Right.
and a lot of the public comments is that the time of releasing records under HIPAA is going to reduce to 15 days, which is going to align with ONC. And so I won't be surprised though if both laws come down and do 10 because so many states are trying to align with California, and there is some legislation going on to make a national data privacy rule that aligns with GDPR, which is a whole different ballgame. So yeah. So
there you go. So, I mean, Debbie, thank you so much. I know
you're
we
welcome.
ran way over time, but there was questions, and I think both of us can talk forever when we get started. So, in an effort to not keep everybody up super late tonight, thank you, Debbie, again.
Thank you for having me. I enjoyed it.
No, thank you. And the replay of this will be on our YouTube channel. It will be, a link will be posted in the Facebook group. I'll make sure Debbie has a copy, has the link, has everything as well for her posting.
For my page.
And if you do have questions, please do not hesitate. Debbie is a member of the Dental Billing Coding and Insurance Academy group. Ask your questions there. You can tag Debbie, you can tag me. We'll definitely answer your questions. She's the security person. I know computers, but I'm not setting up domains. I still have my IT team that handles that.
So do I.
Ask your questions, absolutely. Hopefully this shed a little light. The big thing to remember, no matter what, these rules will apply to you. They do already. They're going to. It's not going to change. They pushed the enforcement date for information blocking. They pushed the enforcement date for the patient portals. Believe me, they are not going to do it again.
No.
The new upper management of HHS has absolutely no intention of pushing anything.
Nope.
And is super patient centric. So it's not about the providers.
Nope.
It's about the patients. So keep that in mind. Please remember it applies to everybody. Debbie, thank you again.
Thank you for having me.
Oh, hold on a minute. Oh, that was just a thank you. Okay. I saw one more Q&A pop up. But all right. Thank you, everybody. Everybody have a great night. Don't forget, if you have any questions, post them in the group. We're here to answer them.